Good morning. It's Wednesday, the 20th of May, and welcome to our daily COVID update. We're going to start directly on the chart, and we'll pay into that now. All right, this is the COVID report for Pinellas County, and a couple of things that I thought were interesting as we looked at this. When you look at the total number of individuals in Pinellas County who have contracted COVID, the vast majority is this light purple. Those are individuals between the ages of 35 and 64. This is significant. Everything below the purple are the people under the age of 64 who have contracted the disease. It's the vast majority. It's well over 80% of all cases have been under the age of 64. That's important because these people who have been infected and are recovering or are now well, that is how we actually have been able to flatten the curve, is as people have become infected, recovered, gotten well, have returned to society, they have antibodies, and that's how we've been able to effectively flatten the curve. One of the things that at first is surprising when you look at the individuals over the age of 65 to 74, that's this yellow, and then those over the age of 75, that represents a smaller portion of the total population that has been impacted by COVID. But what is interesting is the death rate here is much, much higher than it is for the population as a whole. And so when we talk about the seniors being an at-risk population, it's because of their comorbidities, the number of medications they're taking, underlying illnesses and disease. And so we just continue to look at this as we go forward. Here we are for Pinellas County. We're at 1,062 cases with a death rate of 71. This for Pinellas County, our percentage of infection is 6.69. We still went up about 11 cases from the previous night. Our overall in the state of Florida, we went up about 50 cases, and the fatality rate in Florida is running a couple of percentage points below where we are in Pinellas County at 6.69. The one last thing we always want to take a look at is how are we doing with our available resources and making sure that the number of COVID cases do not overwhelm our healthcare system. And you can see we are well in excess of 3,800 available beds, licensed beds, whether they're acute care, long-term care, or emergency room beds. We are ample hospital and long-term facility beds to meet the current need. So the chart is looking good, and let's go talk about Florida. Okay, so hospitalizations in Pinellas County, we're at 320, and in our zip code, we are at 17. That continues to be very stable, consistent over a couple of weeks at this point. In the United States, we are at 1,528,000 cases with 91,000 fatalities. That number continues to rise pretty radically. There's not really been a slowdown. Relates to two things: the increased testing capacity across the United States, and the fact that the majority of our states are now loosening restrictions and entering phase one. Here in Florida, we are in day 17 of the phase one restrictions. We are in day 3 of the governor's advanced restrictions. He did not go to phase 2 last Friday, but he did advance those phase 1 restrictions to further lessen some of the restrictions on your travel and what we're able to do. Here at Regency Oaks, we are tracking 16 residents in the independent living. These are all folks who have returned from hospital, vacations, or are new move-ins, and we are tracking 7 people over in skilled nursing, all related to recent move-ins. We track these people and impose a 14-day quarantine just to make sure that we integrate them safely back into the population. There are no residents or staff members we suspect of having COVID or even flu-like symptoms today, and our confirmed cases continue with 1 resident and 0 associates. Our single resident is recovering and doing well. So as we spoke last Friday, as the governor of the state of Florida advances his phasing, so will Regency Oaks. And so Governor DeSantis Monday went into a second stage of phase 1, and we had always said that as he entered into the next phase, we would enter into the previous stage. So as he goes to phase 1.5, we've made the decision to go into phase 1, and we will begin to lessen some of the restrictions. We're going to do this out of an abundance of caution. We're going to be careful about how we layer and unlayer the restrictions. You've heard me say that we were one of the first to put restrictions in place. We will be the last to take off restrictions out of an abundance of caution, making sure that our residents are safe and that we don't have to later rescind this and start all over again. So we are ready to announce some of those restrictions. And the first that I would like to announce is that effective this Friday, which is the 22nd, we will be unlocking the side doors in both the north and the south buildings and allowing residents to start using our side entrances. We will reactivate the fobs so that you may come and go as you please. And this is more of a convenience issue than it is a safety issue. Residents have been so cooperative in making sure that if they leave the campus, they check in. We're going to continue to ask that as you leave and come back, please check in. Feel free to use the side entrance, but once a day, it's really important that you get your temperature taken and that we're able to log it, because that continues to be the primary means by which we track and get early detection of someone who may have COVID-like symptoms. The second thing that we are announcing is we are opening up the social distancing rule. We have been at no more than 4 people and 6 feet apart. We are now going to expand that to no more than 6 people and 6 feet apart. So it's a gradual increase. It's not going to encompass larger meetings or larger activities, but it is going to allow a few more people to safely gather as long as you maintain that 6-foot distance. We are also ready to announce that we are going to reopen the fitness center with restrictions, and I know this is something many of you have been waiting for us to do. Let's go to the board and I'll review some of these restrictions. The primary driver in making this decision is now that the governor has opened up fitness gyms throughout Pinellas County, we believe that our residents are safer staying here and using our gym rather than going out and visiting the local fitness centers. We will restrict our occupancy to a maximum of 3 people at any time, and we are going to reduce hours. So the gym is not going to be open the same hours that it previously was. It will have some reduced hours. Entry is going to be at time slots so that we can make sure that we're not having more than 3 people in the fitness center at any given time, and residents must sign up in advance at the front desk. Now, Tiffany and Zelko are working on all the specifics, and they will be sharing that with a flyer that should go out late this afternoon or first thing Thursday morning, so that in order to reopen Friday morning, you'll have specifics on what will be allowed and how we're going to manage the process. The fitness center will continue to be staffed by Zelko. Housekeeping will clean and disinfect the gym every night or first thing in the morning before it opens. Residents and staff will be asked to disinfect the touchable surfaces in between each use. So before you get on and after you get off a piece of exercise equipment, we're going to ask that you take one of the disinfectant wipes and wipe down the handlebars, the seat cushions, anything that you might have touched, just to make sure that the equipment is safe when you get on and safe when you get off for the next resident who might use it. Residents will be required to wash their hands in the fitness center restroom before and after each workout. The gym will close for an hour in the middle of the day so that we can do a midday cleaning. Masks are required when you are in the fitness center, and any resident who is under quarantine with symptoms or non-symptomatic and on a self-imposed quarantine, you will not be granted access. The satellite gym in the north will not reopen at this time because it is not supervised and staff is not there to ensure that proper sanitation and overcrowding is not occurring. So we're very excited to make some of these changes because it signals a return to some sort of normalcy. I know if you're like me, you're probably sick and tired of being locked up in the apartment, and this is the first true indication that maybe we can begin to put this behind us and return to some sort of normal operations. We are in the process of getting our phase 1 dining restrictions done, and we hope to be able to announce that either tomorrow or Friday. So look for us to address that in our next video, and we'll give you that update probably on Friday morning. So that's all we have for today. Everybody continue to be safe and maintain proper social distancing. And so everybody take care, have a great day, and we'll see you around the campus.